President Trump's doctors have updated his condition with a new statement released to the press this morning. According to the statement, the president has been fever-free for 4 days and symptom-free for 24 hours. He also has COVID antibodies present in his system. We know he's been given the Regeneron antibody cocktail, the antiviral medication remdesivir, and the steroid dexamethasone. But how do those medications impact the body? For more on this, we want to bring in Dr. Robert Wachter. He's a professor and chair of the Department of Medicine at UC San Francisco. Dr. Wachter, thank you so much for joining us. So the president's doctor says the president has been symptom-free for the past 24 hours and that the president says he feels great. But we do know that COVID impacts the lungs and can cause fatigue and trouble breathing. What are the benefits of the drugs the president is taking, and could some of those, particularly the steroid, be part of the reason that he's feeling well?
Yes, the steroids notoriously can mask the symptoms of serious illness. People will sometimes tell you they feel fine, and yet the underlying illness is still doing its thing. I think most physicians wondered about that. One of the things it can do is give you the sense of euphoria and well-being and even invincibility. And watching him come out of the helicopter the other night and ascend the stairs made us wonder, he feels really good. And then at the top was the reckoning where if you watched him, he was quite short of breath. So he's on 3 different medicines. The antibodies are experimental, not yet approved. And the preliminary evidence is pretty promising. My guess is they will be approved, and it wasn't unreasonable to use them in an older, overweight person who had a reasonably high risk of a bad outcome. The remdesivir is now pretty standard. It's an antiviral medicine. We give it intravenously in the hospital for people that are sick enough to be hospitalized. And it's been demonstrated to shorten the duration of illness, not yet demonstrated to decrease death rate. The dexamethasone, the steroid, is the most interesting one. It has been demonstrated to decrease death rates, but only in people who are quite ill. And so for most physicians, there was a little bit of disconnect hearing the discussion from his doctor about he's not that sick, only a little bit of oxygen need, and yet they decided to give him dexamethasone. The reason that's so dicey is, one, it can cause significant side effects, including mental side effects. But the second is we know that if you give it to patients that are not that sick, there's actually net harm. Most patients actually, on average, do a little bit worse. Whereas if you give it to patients who are very ill, on average, they do better, and it has been the only medicine to demonstrate a decrease in mortality rate. The other medicines he was on, and he was on a few other pills, none of them have been demonstrated to be beneficial.
So what are some of the potential side effects then? We understand that they include anxiety, perhaps depression, and insomnia. Can this cocktail of medications perhaps impact the president's decision-making ability?
Well, all of them can have side effects. The antibodies so far are looking pretty safe, but they're pretty early. They've just been invented, and so we've not had widespread experience with them. The remdesivir mostly can have side effects. And that medicine can cause cognitive side effects. As I said, sometimes euphoria, even mania, mood swings. And so that's the one that has to be monitored carefully, particularly when you're giving it to older people in moderately to high doses, which this is. And also the COVID by itself, particularly in older people, causes cognitive changes in about 20% of people that are sick enough to be in the hospital. So you take COVID that can cause cognitive changes in your thinking, your mood. You take the steroids, the dexamethasone, that can do the same thing. That's worrisome. It doesn't say that we think for sure that he is cognitively altered or his judgment is altered, but it is certainly a realistic possibility that I hope his physicians are assessing in a meaningful way every day. And I hope if they find them, that they're able to speak out and do the right thing, because that obviously would have major consequences if he's not thinking clearly.
Of course. And Doctor, we've heard the president say that he feels great, better than he did 20 years ago. What could happen when he comes off all of these medications?
Well, first of all, the feeling better than 20 years ago, assuming he's being accurate, is that's the steroid speaking. I can tell you that there is nothing about COVID that makes you feel 20 years younger. If anything, it's going to make you feel 20 years older. So that may be the steroids, assuming that he's being truthful about that. The first point before I get to sort of what could happen when he comes off the medicines is that he is decidedly not out of the woods. The time course of COVID, it frequently is that people do fine and are stable and then have an explosion of the illness at the end of week 1 and the beginning of week 2. So he's getting to the period where every day that he continues to feel well with normal vital signs is reassuring, and probably lowers the chance of him having a bad outcome. But he probably still, if you take the data nationally and internationally from what we know, at this point, he probably still has close to a 10% chance of dying of this episode. So that is a very big deal. Now, once he's off the steroids and the other medicines, I mean, the disease is going to play out its own course. Some patients, as you know, never have symptoms. He's obviously not that. He's had symptoms. Some patients have symptoms that last for a week or 10 days. They go away. Some patients continue to feel terribly we now have seen patients who feel terrible for a month or 2 or 3 with muscle aches and fevers. And so those things, which may be being masked by the steroids, could come back. So there's no good way of predicting that. So far, he's doing well. There's a good chance he'll continue to do well, but he could get worse in a significant way, and he could also just feel crummy next week and ongoing for several weeks after that.
All right. Well, Dr. Robert Wachter, thank you so much for joining us and sharing your medical insight. We appreciate it.
Thanks for having me.